Welcome to the KTE model, otherwise known as the Know Thy Enemy model. If you, or anyone you know, was recently diagnosed with cancer, this video is meant for you. Our videos are designed to help people understand their cancer, so that they can then participate meaningfully with their doctors in working through treatment issues and options. We have carefully assembled and curated the latest research and treatment methods. The information contained in these videos are provided free of charge and out of goodwill to those diagnosed with or suffering from cancer, and their families and friends. The information we will be sharing in this video is meant to help you formulate questions and issues for discussion with your doctors, and should not in any way be seen as an alternative to medical advice. The first and very important message we would like to bring to your attention is that you have to understand specific things about the cancer you have been diagnosed with. You have to understand your cancer to understand what type of treatment might be available to you. This will aid you in then understanding the implications of treating your cancer. We will do this by introducing you to the KTE model. It is a simple way of understanding the different classes of cancer and the treatment used. Once you have positioned your specific class of cancer on the KTE model, you will begin to realize the broad implications of treatment options available to you. We start building our Know Thy Enemy model by examining the different classes of cancer. From the point of view of treatment, there exists 3 classes of cancer. The 3 classes of cancer is not something we came up with. It is taken from one of the leading books on the biology of cancer. The KTE model identifies 3 main classes of cancer, being good, intermediate, and bad. Each of these classes of cancer is associated with a particular treatment objective and treatment strategy. It is very important for you to know in which one of these 3 classes of cancer, the cancer you have been diagnosed with, belongs. Identifying your class of cancer in one of the 3 classes of cancer is where we will start. Let's start with the class of cancer which has been detected early. Such a cancer might well be indolent. An indolent is a cancer that is small and is progressing so slowly that it is unlikely to ever present a problem. We call this class of cancer good cancers. So a good cancer then is one which is small, progressing slowly, and may well never present a problem. We will now explain what an intermediate cancer means. If the cancer is detected early but is not indolent, it means it will more than likely turn out to be an earlier stage cancer. These are what we call intermediate cancers. The intermediate class of cancers are earlier stage cancers where the cancer is localized and has not yet spread. It is also very likely to be homogeneous and not evolving very fast. We would like to explain to you what the term homogeneous means. Every single living organism is governed by their genes. Think of genes as the recipe book of living things. Genes instruct our cells to divide and governs what they will become. Cancer is caused by mutations in our genes, specifically associated with cell division and control. Homogeneous means that new cells have DNA that are identical. In terms of cancer, a homogeneous cancer is one where all the cancer cells are genetically identical or very similar, i.e., a single clone. This is in contrast to a multiclonal heterogeneous cancer, as will be seen when we talk about bad cancers. We will now look at the third type of cancer, namely bad cancers. An intermediate cancer which is not treated or is incompletely treated and then recurs, will start progressing and become more dangerous. And most of these cancers will sooner or later reach a Rubicon. At this point, one of the cancer cells crashes, becomes genetically unstable, and the cancer starts to evolve much faster. Once this happens, one has what is known as a later stage cancer, or what we call a bad cancer. Bad cancer mutates and evolves much faster and becomes heterogeneous. Heterogeneity means that the cancer consists of a number of genetically distinct subclones, and each time the cancer cells divide and multiply, the possibility exists that yet another subclone will come into being. Heterogeneity and the faster mutation rate leads to resistance to treatment, which becomes a critical issue in trying to cure bad cancers. Furthermore, bad cancers will most likely spread to other parts of your body. When this happens, the cancer is known as to be metastatic, which makes the cancer even more difficult to treat. But there is more to be known about bad cancers, and it is not good news. Unfortunately, sometimes an early cancer can also be bad. A cancer can be genetically unstable from birth. These are known as born to be bad cancers. There are, in effect, two different pathways to a bad cancer. Usually it arises from the progression of an intermediate, which then becomes genetically unstable. But some cancers are just born bad, and are bad even if detected early. So, we have identified the three classes of cancer and broadly how they arise: the good, the intermediate, and the bad. We can now complete the model. What do these three classes mean in terms of treatment objectives? Firstly, a good cancer. A good cancer need not be treated. Indeed, it should not be treated, as treatment can sometimes lead to progression. It should rather just be watched. An intermediate, on the other hand, should be treated with the objective of cure. It is localized, homogeneous, evolving slowly, all of which are favorable for a curative strategy. One is looking for total elimination of the cancer, even by treating aggressively if necessary. Should even one cell be left behind, it will quite likely grow into a new cancer. Finally, a bad cancer is unlikely to be cured. It is heterogeneous, fast-evolving, and resistant. The objective here should be to contain, more than likely through an adaptive and ongoing sequence of treatments. And that concludes the KTE model. We looked at the three classes of cancer. We have explored the key pathways to each of these classes, and we have highlighted the treatment strategy for each class. And here is the summary, a roadmap to knowing your enemy. The first step is to position your cancer in terms of which class it belongs to. This is done primarily through two numbers on your pathology report. Those are the stage of your cancer and the grade of your cancer. Stage refers to the extent of your cancer. Stage is the extent of a cancer in the body. Staging is usually based on the size of the tumor, whether lymph nodes contain cancer, and whether the cancer has spread from the original site to other parts of the body or not. It ranges from early stage, stage 0, a precancer, to the notorious metastatic stage 4, stage 0. Abnormal cells are present but have not spread to nearby tissue, also called carcinoma in situ. Stage 1, stage 2, and stage 3. Cancer is present and locally invasive. The higher the number, the larger the cancer tumor, and the more it has spread into nearby tissue. Stage 4. The cancer has spread to distant parts of the body. The other indicator is grade. Grade measures how abnormal the cancer cells are. Grade is a description of a tumor based on how abnormal the cancer cells and tissue look under a microscope and how quickly the cancer cells are likely to grow and spread. Low-grade cancer cells look more like normal cells and tend to grow and spread more slowly than high-grade cancer cells. It ranges from the relatively normal low-grade grade 1 to the highly abnormal high-grade grade 3. Grade 1 cancer cells are low-grade. They are relatively normal, well-differentiated, and less aggressive. Grade 2 cells are intermediate grade and moderately differentiated. Grade 3 cells are high grade. They are highly abnormal, poorly differentiated, and aggressive. With these definitions behind us, we can now look at positioning your cancer. A good cancer is stage 0, a precancer, or stage 1, early stage, and is low grade, grade 1. An intermediate is medium in both stage, in the range stage 1 to stage 3, and grade, grade 2. A bad cancer is late stage, stage 4, and high grade, grade 3. Having now positioned the cancer you have been diagnosed with, we finally turn to devising a treatment strategy fit for your class, stage, and grade of cancer. devising a treatment strategy after positioning your cancer on the KTE model, we will start with good cancers. A true indolent should not be treated. There is, however, still a degree of uncertainty in the identification of the true indolents, and thus there remains some risk that a good cancer could still progress at some stage, an issue which science is actively pursuing. So, the appropriate response for a good cancer is not to just ignore the tumor, but rather to undertake a regular and ongoing process of watchful waiting in case it starts turning nasty. Watchful waiting is a systematic and routine program of checking and testing a patient's condition, but not giving treatment unless symptoms appear or change. It is best known in lower-grade prostate cancer, where the program is called active surveillance. Turning next to the intermediate cancers. These cancers are eminently treatable and offer a good chance of cure. If the cancer can be fully excised through surgery, then game over. If genetics identify a targetable driver mutation, then targeted therapy may be a good option. If treated conventionally, some or all of surgery, radiation, and chemotherapy, then treatment should, if necessary, err on the side of aggression, lest some cancerous cells escape and start evolving into a more advanced cancer. What is targeted therapy? The key mutations driving cancerous growths in any patient can often be identified through genetic sequencing, and there is an ever-growing class of drugs which have been developed to specifically target and block such mutations. These are called targeted drugs. A major advantage of these drugs is that they only target those cells that are damaged and have the specific mutation. The genetic sequencing of a tumor at diagnosis is an essential prerequisite for targeted therapy to be considered. Now for a bad cancer. Bad cancers need a different mindset. They evolve and change over time in response to treatment. You need to prepare for the long haul. It's a war rather than a battle. In your discussions with your doctor, you should be thinking strategy, not just treatment. If your cancer is bad, the objective is to contain. We strongly recommend that you read and digest the appropriate sections on our website and in our book. There are some newer treatment opportunities for bad cancers. Track and treat is a fairly obvious strategy, but potentially powerful. A bad cancer evolves its response to treatment. Track and treat is an adaptive strategy, monitoring the changes in the cancer and adapting the treatment accordingly. The new technology of liquid biopsy is an important opportunity in this regard. Liquid biopsy is a simple blood test, along with genetic sequencing to track evolutionary changes in a cancer. Another option for bad cancers is immunotherapy. Let me explain what immunotherapy is. Immunotherapy is a cancer treatment that does not attack cancer directly, but rather helps the immune system to attack cancer. A breakthrough over the past 10 years has been the introduction of immunotherapy drugs called immune checkpoint inhibitors, ICIs. This, conceptually, is how they work. Cancers protect themselves from the immune system by cloaking themselves with defenses called immune checkpoints. ICIs are designed to destroy this cloak, thereby allowing the immune system to continue their attack on the cancer. ICIs can sometimes work as a monotherapy, but the next frontier is combination immunotherapy. This may, for example, also include some form of vaccine to help stimulate the immune system along with an ICI. And here then is the full summary roadmap showing each class of cancer, good, intermediate, and bad. And for each class, its positioning in terms of stage and grade and treatment considerations, objective and strategy. So that concludes the KTE model and its implications. We thank you for your attention and hope you found it useful. If you are interested in reading more about this, then have a look at our website, ktemodel.com. Included in the website is also a free download of our book, I've Got Cancer, Now What? Thank you for watching this video. We wish you well.